Nursing 474, Population-Based Public Health Nursing Practice, the Intervention Wheel. Here are your weekly learning objectives for week 2 again. They were presented in the first 3 PowerPoints for this week. The Intervention Wheel, Origins and Evolution. In these times of change, the public health system is constantly challenged to keep focused on the health of populations. The Intervention Wheel, a graphic illustration, is a conceptual framework that has proved to be a useful model in defining population-based practice and how it contributes to improving population health. The wheel is derived from practice of public health nurses, but these interventions are also used by other members of the public health interdisciplinary team. The original version of the wheel resulted from a grounded theory process carried out by the public health nursing consultants at the Minnesota Department of Health in the mid-1990s. Debates about healthcare reform and its impact on the role of local public health departments created confusion about the contributions of public health nursing to population level health improvement. Most of these interventions were implemented at 3 practice levels: with individuals, either singly or in groups, families, with communities as a whole, and with systems that affect the health of communities. When it was first published in 1998, adoption of the model was rapid and worldwide. It has been incorporated into the public and community health coursework of numerous undergraduate and graduate curricula and serves as a model of practice in many state and local health departments. The following slides will present assumptions underlying the intervention wheel. The intervention wheel is based on 10 assumptions. Assumption 1, defining public nursing practice. Public health nursing practice is defined as the practice of promoting and protecting the health of populations using knowledge from nursing, social, and public health sciences. This is from the American Public Health Association Public Health Nursing section in 1996. Assumption 2, public health nursing focuses on populations. The focus on population as opposed to individuals is a key characteristic that distinguishes public health nursing from other areas of nursing practice. Assumption number 3, public health nursing practice considers the determinants of health, including health inequities, significant health disparities, and determinants of health. Number 4, public health nursing practice is guided by priorities identified through assessment of community health. Community assessment includes a comprehensive assessment of the determinants of health. Data analysis identifies deviations from expected or acceptable rates of disease, injury, death, or disability, as well as risk or protective factors resulting in a lengthy list of community problems and issues. Assumption 5, public health nursing practice emphasizes prevention. Prevention is anticipatory action taken to prevent the occurrence of an event or to minimize its effect after it occurred, and includes primary, secondary, and tertiary prevention. Assumption 6, public health nurses intervene at all levels of practice. Community level, practice changes community norms, attitudes, awareness, practices, and behavior. System level practice changes organizations' policies, laws, and power structures within the communities. Individual level practice changes knowledge, attitudes, beliefs, practices, and behaviors of individuals. Assumption 7, public health nursing uses the nursing process at all levels of practice. Public health nursing must customize the components of the nursing process, which includes assessment, diagnosis, planning, implementation, and evaluation to all 3 levels of practice. Assumption 8, public health nursing practice uses a common set of interventions regardless of practice setting. Interventions are actions taken on behalf of communities, systems, individuals, and families to improve or protect health status. The intervention wheel encompasses 17 interventions. surveillance, disease and other health investigation, outreach, screening, case finding, referral and follow-up, case management, delegated functions, health teaching, consultation, counseling, collaboration, coalition building, community organizing, advocacy, social marketing, and policy development and enforcement. All of the set of interventions, the common set of interventions, can be found in your textbook as well. Assumption 9. Public health nursing practice contributes to the achievement of the 10 essential public health services that describe what the public health system does to protect and promote the health of the public. The interventions are the how of the public health practice. Assumption 10. Public health nursing is grounded in a set of values and beliefs. These values and beliefs define the why of the public health nursing practice and inspire, guide, direct, and challenge public health nursing practice. They are listed as the cornerstone of public health nursing. They are population-based or focused, grounded in social justice, focuses on the greater good, focuses on health promotion and disease prevention, does what others cannot or would not do, is driven by the science of epidemiology, organizes community resources, and represents a long-term commitment to the community. Using the intervention wheel in public health nursing practice, the wheel is a conceptual model. It's conceived as a common language or catalog of general actions used by public health nurses across all practice settings. It creates a structure for identifying and documenting interventions, thereby capturing the nature of the work. The scope and standards of public health nursing include the intervention wheel as one of the several public health nursing frameworks used in practice today. The components of the model are described in the next section. I'm going to describe the components of the model. Component 1, the model is population-based. All 3 levels of practice, community, systems, and individual or family, are population-based. Component 2, the model encompasses 3 levels of practice. Public health nursing practice intervenes within communities, the individuals and families that comprise the communities, and the systems that affect the health of communities. Interventions at each level of practice contribute to the overall goal of improving population health. No one level of practice is more important than the other, and many are addressed simultaneously. Component 3, the model identifies and defines the 17 public health interventions, as we noted previously. All interventions except case finding, coalition building, and community organizing are applicable at all 3 levels of practice. The speed at which the intervention wheel was widely adopted may be attributed to the balance between its practice base and its evidence support. The intervention wheel has led to numerous innovations in practice and practice education since it was first published in 1998. In 2007, the ANA officially recognized the intervention wheel as a framework in the public health nursing scope and standards of practice. Applying the nursing process in public health nursing practice, public health nurses use the nursing process at all levels of practice by customizing the components of the nursing process, of course, which includes assessment, diagnosis, planning, implementation, and evaluation.